Here's a shocking reality. Millions of Americans are walking around right now with a silent killer coursing through their veins, and they have absolutely no idea. The American Heart Association just dropped their most significant bombshell in nearly a decade, completely revamped high blood pressure guidelines that are turning everything we thought we knew about hypertension on its head. And here's where it gets controversial. They're pointing fingers at something most people never suspected could be sabotaging their cardiovascular health. Wilmington, North Carolina. After 8 long years of using the same standards, medical professionals are now working with an entirely fresh playbook for diagnosing and treating elevated blood pressure. This isn't just a minor tweak, it's a fundamental shift in how we approach one of America's most widespread health threats. Dr. Frederick Meine, a cardiovascular specialist with Novant Health Cardiology, breaks down the revolutionary changes into 2 game-changing principles that every person should understand. The primary focus now centers on heightened awareness of blood pressure levels, combined with much earlier intervention strategies, Dr. Meine explains. But equally important is empowering individuals to become active participants in their own wellness journey. These updated standards address numerous factors that previous guidelines barely acknowledged when discussing hypertension causes. What makes these guidelines so different? They're taking a comprehensive 360-degree approach to understanding what actually triggers dangerous blood pressure spikes in real people living real lives. We've evolved from a narrow symptom-focused perspective to embracing a complete, interconnected understanding of hypertension triggers, Dr. Meine elaborates. While genetic predisposition remains important, and excessive sodium consumption still matters, and physical inactivity continues to play a role, we now recognize that insufficient sleep patterns, chronic stress levels, and countless other daily lifestyle factors work together like pieces of a puzzle to create the perfect storm for elevated blood pressure. But here's where it gets really interesting, and this is the part most people miss. One of the most startling revelations involves a habit that millions of Americans indulge in regularly without connecting it to their cardiovascular risk. Reducing alcohol intake has emerged as one of the most powerful and surprisingly accessible methods for lowering hypertension risk. Think about that for a moment. Something as simple as cutting back on evening cocktails or weekend beers could be more impactful than you ever imagined. The connection between alcohol intake, particularly when consumption becomes excessive, and elevated blood pressure readings is absolutely undeniable, Dr. Meine states with conviction. The updated recommendations are crystal clear and might surprise you. Complete alcohol abstinence represents the ideal goal, but if that seems unrealistic, strict limitations become essential. Men should cap their intake at no more than 2 alcoholic beverages daily, while women should restrict themselves to just 1 drink per day. These aren't arbitrary numbers. They're based on extensive research into how alcohol directly impacts your cardiovascular system. Implementing these evidence-based guidelines can serve as your roadmap for maintaining optimal blood pressure levels as you navigate the aging process. The foundation of success lies in cultivating sustainable, healthy behaviors, which absolutely must begin with intimate knowledge of your personal blood pressure patterns. Here's something that might shock you. I'm consistently astounded when meeting new patients for initial consultations. An overwhelming majority have virtually no awareness of their daily blood pressure fluctuations, Dr. Meine reveals. This knowledge gap represents a massive missed opportunity for early intervention and prevention. The most reliable method for tracking your blood pressure involves investing in a quality home monitoring device. Why? Because taking control of your cardiovascular health doesn't require waiting for annual checkups or relying solely on brief medical appointments. And this is where the controversy really heats up. Are we as individuals doing enough to take responsibility for our own health outcomes? Or are we too comfortable letting medical professionals handle everything while we remain passive observers in our own wellness stories? What's your take on this? Do you think these new alcohol consumption limits are realistic for most people? Or are they setting an impossibly high bar? Have you ever connected your drinking habits to your blood pressure readings? Share your thoughts and don't hold back if you disagree with these recommendations. The comment section is the perfect place to spark this important conversation about personal health responsibility versus medical guidance.